treatment of post-inflammatory hyperpigmentation different?
It's a little bit different because in post-inflammatory hyperpigmentation, you want to treat first the cause of cause of pigmentation, which is the inflammation. So the most common cause usually with teenagers or girls that are picking on their acne. So this type of picking of acne make the pigmentation more and more. And
Call it acne excorié de jeune
acne
fille.
excorié de jeune fille. And it secretes more inflammatory cytokines and inflammatory mediator from the skin that cause more pigmentation. So this is a very important thing. And if there is any cause of inflammation, first I want to treat the inflammation first and quickly and stop the cause of inflammation. Then I treat the pigmentation. With this strategy, the treatment of pigmentation is much easier. What I like to use is to treat the acne with something that treat the acne and the pigmentation as well. So there's a lot of molecule that treat both as well. So I like to do this. I like to do some peelings after treating the inflammation, and after the acne resolves, I like to do peeling, and of course the maintenance treatment for a very long time with hydroquinone or with non-hydroquinone compound, doesn't matter.
Like thiamidol.
Like the thiamidol. And if I'm gonna use hydroquinone, I use it like on weekend therapy. But if I'm using something like thiamidol, I tell them stay on it for like a good 3 to 6 months. And then the most important thing, it needs, as you said, Dr. Samar, one exposure to the sun, and then you go back to square zero like melasma.
Yeah. And I want to add only one point. People don't actually know how important it is to treat acne early.
Yes.
Even if it's a mild acne, treat it early, because there might be some subclinical inflammation that we don't see that can actually result in marks and scars. And acne might be like a temporary condition, but the scars and the pigmentation will last long.
True.
And you're very, very right, Dr. Luay. And I want to add something. There was this study about the effect of the sun on the acne. So it was shown that exposure to the sun to acne, with the patient who have acne, it increased the incidence of scars and pigmentation.
This is very important because a lot of patients actually go to the beach and tan to improve their acne.
Yes, and this is what the misconcept, that the sun improves acne. No, the sun does not improve acne. The sun improves increase the possibility of the scarring and the pigmentation. So that the position of the sunscreen in the acne prescription is very important, and patients usually forget this.
So last question, how do we choose the right sunscreen for us? Dr. Loeko.
Well, we have first to start with the basics. Then we have to choose a broad spectrum sunscreen that protects against the ultraviolet A, ultraviolet B, and then the SPF has to be at least 30. 50 is also good. And then we have, like most sunscreens are water resistant, which is good. And if a patient has a tendency for pigmentation, I would go for tinted sunscreen that contain iron oxide. That would help. Then if we're talking about patients who are old, they can actually combine sunscreen they can use sunscreen with anti-aging ingredients, yes, antioxidants.
Dr. Amin, what about the skin type?
No, for me, the most important thing when choosing the sunscreen, it's the type of the skin of the patient. So if the skin is oily, I never choose a cream base. I use an oil, a dry touch, a serum, a fluid, a dry touch, or gel. If the patient has a very dry skin, I use it cream. So the problem is the compliance with the sunscreen. So if you give a patient with oily skin a rich based cream sunscreen, they will develop acne, and they will not use it. So choosing the sunscreen, the right sunscreen according to the type of the skin is very important. And like Dr. Luay said, the 3 main important things is to be broad spectrum above
SPF above 30,
and just to apply it every 4 hours. Even if it's water resistant, you have to apply it every 4 hours.
Very good.
Exactly.
I think we covered everything. Thank you.
Perfect. Thank you.
Thank you.